Impact Health the Gambia, a registered non-profit organization with tax-exempt status in the United States of America, was on Thursday, December 29, 2022, launched at a local hotel in Kololi. The organization's primary objectives are to provide essential medical supplies to public hospitals in the Gambia, provide quality healthcare improvement consultations, and facilitate training for medical health and addiction services. In his welcoming remarks, the organization's country representative, Babukar M.A. Sen, says Impact Health the Gambia is here to serve every Gambian.
Impact Health the Gambia is here to serve the nation. We're here to serve everybody, regardless of where you live or where you reside in this nation, regardless of your political affiliation, regardless of your religious or whatever you think you identify yourself. So we are here to serve everybody, every Gambian, and this is something very important.
Mr. Sen added that their objectives are in line with the Ministry of Health objective. That is why they are ready to work closely with them.
The objectives of Impact Health the Gambia is very much in line with the objective and the strategic vision of the Ministry of Health, which is to make healthcare services affordable and accessible to every Gambian, regardless of where you reside in this beautiful country. But one thing unique about Impact Health the Gambia is the fact that we're not here to create a parallel system. We're not here to reinvent the wheel. We want to partner with the Ministry of Health and partner with Edward Francis, Kanifing, Bundung, and Tanka Tanka to see how best we can work collectively and strengthen these institutions to better deliver to the Gambian people. And that's exactly what we are doing. And that is something very unique.
Speaking at the event, the Chief Executive Officer of Innovarax, Dr. Ismaila Baji, says Gambians need builders and not donors.
But the Gambians don't need donators. We need builders. The Gambians don't need expats. We need patriots. Because for so long, we keep doing the same repetitive cycle. That's why the first thing I noticed about his logo, it says innovate, adapt, but the most important aspect was sustain. Only we could sustain and build the Gambia we want, because nobody else is coming to save us. So for everybody who's here, yes, prayers, we're a praying society, but also let's get behind people like Abdul Wahab. Let's support leaders like Mr. Singh. Let's listen to the concerns of Dr. Njai. Let's listen to the concerns of the army, because the soonest Gambia realized that we're stronger together, we could change our nation faster than any nation in the world.
Dr. Baji also emphasized the need for investment in the country's healthcare sector.
Almost 60% of our population have not celebrated their 25th year-old birthday. If you look at healthcare, right, majority of the people don't need emergency care. They just want to make sure healthcare is accessible early, and then citizens are contributing their quota to reducing our health footprint. An average Gambian could tell you everything that's wrong at Kanifing Hospital, at Edward Francis, but if you ask the same Gambian, when was the last time you got up and went and checked your blood pressure? When was the last time you decided to eat less sugar? We are not doing our part to help reduce the burden of our health system. So this is also for a challenge for a lot of us who want to contribute a little quota that we would not benefit from the work he's doing. But his son, his daughter, their future husbands and wives will reap the benefits of a Gambia that can be. So for my fellow healthcare professional, for my fellow diasporan, I admire you, and we need to go and find more people who are willing to do the hard work. Because the easiest thing to do is to donate and leave.
Speaking on behalf of the Chief of Defense Staff, Lieutenant Colonel Abdullah Mane says providing healthcare service is part of their constitutional mandate.
Majority of the investment that we are making in the health services are going back to the Gambian people, because it is part of our constitutional mandate to provide services to the Gambia civil population. if you look at it, we have different areas. So we have invested in health. We have medical doctors of different specialties. We have nurses of different specialties who are soldiers. We have public health officers, laboratory, even up to a laboratory scientist, we have it. And then we have been engaged in every sector of the health system.
The founder of Impact Health The Gambia, Abdul Wahab Manjang, talks about his organization areas of focus.
Our areas of focus. What made us unique? What made Impact Health The Gambia unique? We are approaching this our mission in this country in 3 areas: providing basic medical supplies. We heard the lack of resources. And if you don't have enough resources, you may not have enough resources, but if you don't have adequate resources, it's going to be challenging. It's going to be a challenge for you to deliver that quality of care that you need. And as a result, you may have a lot of dissatisfaction in the service delivery. And a quality of care can be received in the absence of quality improvement consultation services. That's my primary job, and that's what I do for a living. But how can I offer that to the country that I came from, where I have loved ones? I'm not getting any benefit, any dime from it, neither my colleagues as well. But it's about us working together with our partners here, not telling them what to do, but asking them what do they think will help their processes improve. Offering seminars for mental health and addiction services.
Mr. Manjang further highlights some of the institutions they will be working with.
Our stakeholders, Carnifing, obviously Mr. Babukar, Edward Francis Small Teaching Hospital, Tanka Psychiatric Hospital, and the Gambia Armed Forces. These are folks who we are going to partner with. And we are not just going to send stuffs to them, but telling us what they need, and we will work with our team to send them what they need. And they will need to give us the accountable report, meaning the inventory of the items that we're going to send them. But outside of the financial piece, that process, the mental health and process improvement has no financial implication or financial involvement. So that space, we are definitely gonna ground it on getting that successful outcome that we want.
Other speakers include the mayor of Banjul, Rohimalik Low, who thanked the founder for the investment in his country's healthcare sector.
I wish to commend your efforts, my dear brother, in choosing to work in the health sector, given its importance as well as its challenges that we must try all to overcome. As I understand, your goal is to strengthen the Gambia health system, and to me this is critical in the lives of the people of this country.
Impact Health The Gambia is an initiative that will mainly focus on helping strengthening the Gambian's healthcare system, among others. Reporting for Kerr, Fatou, I am Ramatulai Jawo.